Integrative medicine is, I think it's the medicine that people want to practice.
It is seeing the whole person and tapping into a wide range of healing modalities and approaches in the context of the person that we are working with.
It utilizes therapies and often Eastern medicine to try to add to the medical therapies and improve the patient's health.
What it means is we actually use many different things at the same time. And by combining this, we actually are able to provide much, much better pain and symptom control with far less side effects.
Our program started in 2008, and it really was, in the very beginning, just a couple of providers who really felt like there was a gap in the care that we were providing our patients.
Often, just giving medications is not effective enough. So within our integrative medicine program, both in Oakland and San Francisco, we offer many different services.
We use acupuncture, massage, mindfulness techniques, deep breathing, aromatherapy to treat all kinds of different symptoms.
The hospital environment is an intense environment. We're taking people out of their homes. We're taking people out of their communities, out of the areas where they feel safe.
Our holistic care, it helps the kids think that they're not in the hospital. It takes them away from the beeps and the noise and the sounds of nurses and doctors to create a serene environment for them.
Well, when my legs are hurting, she does my legs a lot longer than my arms and that stuff. I like it when she does my legs and my head.
We can see the difference from 1 week to another. They tell us the pain has decreased. They tell us they're more functioning, they're more energetic.
Acutherapy makes me feel relieved from my legs, my whole entire body. But the first time I done it, I was anxious because of the needles. I don't like needles. But when I got through it, I felt relieved. It didn't hurt at all, and my pain was lower than usual.
The acutherapy service at UCSF Benioff Children's Hospital is one of the most advanced and robust programs in the entire country.
I've been through thick and thin, and the reason why I come to Children's Hospital is to get my body moving so I can feel better.
So I noticed it instantly that she's not as anxious as she has been. I've also noticed that I haven't been able to give pain medication as much as I was, and she's not on anxiety medication anymore.
The truth is that this is not covered by insurance. So the only way we can provide those amazing services is because the community here in the Bay Area feels that this is the right thing to do.
If you have to make a decision on whether you want to pay your rent and get groceries or you want to pay for acupuncture for your kid, it puts you in a really hard position. So our greatest goal in this program is to make sure it's accessible to everybody.
Currently, our integrative medicine team is supporting as many patients as we possibly can, but it's a fraction of the patients who need it.
More funding would allow us to do a lot of things that would be really beneficial for the children. So we'd be able to expand our program both in the hospital and out of the hospital, and to be able to expand it to all patient populations that deserve it.
When people feel more centered, when people can breathe, they are actually accessing their health and their wellness at a deeper level. So that improves their immune system, and that can only help in terms of whatever treatment they're also receiving.
When you have all those ingredients, magical things happen. That's integrative medicine.